Well, hello, everyone, and welcome to this month's call of the Veteran Oral Health Action Collaborative, supported by the CareQuest Institute for Oral Health and the American Institute of Dental Public Health. My name is Stacy Chazen, and I'm going to be your facilitator for today. Our call this month is focused on the connection between veteran mental health and oral health, and we're happy to walk you through what we're going to cover. Next slide, please. So here's our disclosure here from all of our presenters that they don't have any financial arrangement or interest with corporate organizations offering financial support or grant monies for this continuing dental education program. Next slide, please. I'm going to go over briefly our learning objectives for today's call. One, that you'll summarize the interconnected relationship between veterans' mental health and oral wellness. Two, explain the specific challenges that veterans with mental health issues may face in maintaining optimal oral health. Three, describe collaborative care models that enhance the integration of mental health and oral health. And four, produce a deeper appreciation for the importance of a holistic approach to healthcare for veterans. Real briefly, an overview of CareQuest Institute for Oral Health, which serves as a catalyst for systems change. Through its areas of activation and influence, CareQuest brings forth ideas and solutions to create a more accessible, equitable, and integrated health system for everyone, which this program aims to support. Next slide. About AIDPH, if you're not familiar with us, AIDPH is a 501c3 nonprofit organization with the vision of a justice-oriented oral health system. Our mission is empowering communities to advance oral health through science, education, and advocacy, and we do that with a focus on four core communities: individuals living with disabilities, individuals in rural communities, veterans, and LGBTQIA+ communities. Through this program, this is a great example of how we're partnering with CareQuest to advance veteran oral health. We're doing this by focusing our programming, and in particular, this Veteran Oral Health Action Collaborative, on research, access, and advocacy. These are three things that we seek to advance through this program, as well as to leverage and disseminate. Next slide. The Veteran Oral Health Action Collaborative, if you haven't been with us before, is made up of monthly seminars. The seminars include interactive applied learning, as well as a presentation from a didactic expert each month. We offer a certificate for folks who complete sessions and successfully complete competency evaluations. You can do that by attending these sessions live, or watching the recordings on the AIDPH website. And for those who attend the sessions live, we also offer continuing education credits. Next slide. More Care. So More Care is CareQuest Institute's program aimed at addressing health disparities through the integration of oral health into primary care practice and the development of dependable oral health care networks. And as we've moved through our topics in the Veteran Oral Health Action Collaborative this year, or VOHAC, we've lifted up the notions underlying More Care, including integration of care and coordination of care, and in this program with a specific focus on the care and healthy outcomes of veterans. Improving veteran oral health through integration. Some elements support this, again, that we've hit on throughout our programs this year include shared responsibility for the oral systemic connection, use and development of a referral network, transitioning care models, an environment of improvement, and the effective use of health information technology that advances person-centered health outcomes. Next slide. So it's my pleasure now to introduce our didactic speaker for today, Jessica Elwell, who's Executive Director of the organization Everyone for Veterans. Jessica and her organization are responsible for advancing the vision to create highly effective, ethical, impactful services and supports for veterans and their families, including free and comprehensive dental care. Jessica is the proud daughter of veterans and has a long history of successfully promoting inclusive and diverse human services programs through collective action and advocacy. And as Jessica gets started, I'm going to ask folks to pop any questions they have into the chat box as she goes along, and we'll turn to those at the end of Jessica's presentation, which will be in about 20 minutes or so. So Jessica, take it away.
Thank you so much, Stacy, and thank you, AADPH, for having me today. I'd like to share with you what we have learned from working with veterans over these last 6 years. We will be discussing the mental health challenges that many of our nation's heroes experience and the impact that this has on their dental health. We will also discuss the practical steps that you can take to improve the quality of life of veterans and their families in your local communities. While this information is intended to be beneficial for those in the dental industry, this information is also important for all civilians to understand. By understanding the lived experience of our veterans, we can build stronger and more caring communities. Next slide, please. At E4V, we realized that the health and well-being of our country's military veterans deserves a lot more attention. Many of our returning veterans experience varying degrees of physical and mental hardships as a result of their service. The homecoming theory, which was developed following World War II, identifies challenges that returning veterans face when transitioning back home. This theory states that when individuals are separated from their social networks by both time and distance, experience varying situations of separation can create a sense of unfamiliarity. This unfamiliarity can cause shock and varying challenges while working to reestablish connections. Often these complications increase the risk of long-term problems. Many studies estimate that 40% of returning service members are in need of treatment for mental health issues and suffer from co-occurring disorders. Once back home, many veterans lack financial support and resources needed to address these life-altering experiences that they faced while deployed. Our veterans often report feeling isolated. They feel that others do not understand them or cannot relate to their lived experience. Next slide, please. Our focus today is on the interconnectedness of mental health and oral wellness. Interconnectedness refers to the concept of how different elements and entities are interconnected or interrelated to one another. Mental health challenges can lead to poor dental health for veterans. Mental health disorders such as post-traumatic stress, depression, and substance use disorders make it difficult for veterans to practice good oral habits regularly. It is well established that decision-making can be challenging when living with mental illness. There's often anxiety and low self-esteem, and these result in our veterans delaying or being unable to navigate the difficult process of seeking dental care. Substance use disorders can also have an impact on one's overall health. It can lead to increased risk of heart disease, stroke, and cancer. Substance use can also worsen existing mental health conditions such as anxiety, depression, and PTSD. Next slide. In this Journal of Oral Medicine and Oral Surgery article, researchers aimed to review the results and impact of chronic stress on periodontal health. This is a simple diagram of a very complex physiological response and the interactions of the biological mechanisms and behaviors linking stress and periodontal disease. Stress is a significant factor with mental illness, and there's a strong connection to oral health. There are several pathways. Stress activates the hypothalamic pituitary adrenal axis, resulting in increased secretion of cortisol and glucocorticoid hormones. Glucocorticoids introduce changes in the inflammatory response and changes in the level of biomarkers, causing reduced host response and promoting chronic inflammatory damage. Stress has been shown to affect behavioral changes. Where motivation declines, oral hygiene deteriorates, and there's more likelihood for smoking, alcohol consumption, poor diet, bruxism, and occlusal trauma, which contributes to periodontal disease progression. Addressing psychological factors such as stress and depression is an integral part of optimal dental health and treatment and prevention. In addition to having good oral hygiene, we must address the factors that exacerbate dental diseases. We've talked about biological and behavioral paths. In addition to these, many veterans are prescribed psychotropics to manage their mental health conditions. These medications often result in varying degrees of diminished salivary flow. Dry mouth is a common side effect of these medications, and dry mouth has been well documented to contribute to rampant tooth decay and periodontal susceptibility. Preventative measures of oral moisturizers and mineralization with fluoride are crucial for prevention. For our medical colleagues, it is important to be vigilant about this when prescribing these medications. Next slide. To make matters worse, veterans often face a range of obstacles when attempting to get the dental care they need. These obstacles include lack of insurance coverage, inadequate coverage, long wait times for appointment, limited access to providers, limited urgent services, and lack of knowledge about available services. This is due to a combination of factors, including a lack of veteran-specific dental care programs, limited access to dental providers, and the inability to get to a dental clinic. Also, there are many financial constraints. In addition to this, many veterans lack the access to dental care due to their geographic location, as many military veterans live in rural or underserved areas where there are few dental providers. It is important to recognize these existing barriers to dental care for veterans, as they can have a significant impact on their long-term health. Without proper dental care, they can experience varying degrees of oral health issues, including cavities, gum disease, and tooth loss, as well as other systemic health conditions. It's crucial that organizations and our government work to reduce these barriers and ensure that veterans have access to the dental care that they deserve. Next slide. As we discuss the need for access to dental care for our veterans, a key component that we must address is the lack of civilian understanding. Most civilians do not realize that more than 85% of veterans that are enrolled in the Veterans Administration healthcare system do not qualify for VA dental benefits. It is a common misconception that veterans get free care from the government, and something that our organization works hard to address each day. Veterans must have 100% service-connected disability, were former prisoners of war, or have other limited situations to have dental benefits through the VA. As we've discussed, oral health impacts overall physical and mental health, and individuals with oral health issues struggle with their confidence, relationships, and unemployment issues. In addition, the veterans that we work with are experiencing generational and systemic poverty, and often employment barriers due to mental health challenges. Our combat veterans have often described returning to civilian life as more difficult than combat itself. There is tremendous stress in their lives, and because of this, our approach to serving these veterans must be compassionate and tailored to them. Next slide. Now that we've talked about the barriers that veterans may experience when trying to receive dental care and the challenges they may experience with oral and overall health, I would like to share where our organization has identified a gap in services for veterans and how we're working towards solutions. Our approach is a collaborative one, and one that many of our practices can be implemented to support veterans in your local settings. Everyone for Veterans was founded in 2017 by Dr. Teresa Chang, a periodontist from Issaquah, Washington, and the 2021 American Dental Association Humanitarian Award recipient. When Dr. Chang began this work, she had no experience with the military, but saw a critical need and decided to do what she could by saying yes to helping our nation's veterans. E4V has grown from a small grassroots movement to a national organization serving veterans and their families in 35 states. We collaborate with civilians and professionals to provide goods, services, and comprehensive dental care at no cost to those who have served. Our staff and leadership are dedicated to serving veterans. Our dental program director was raised on Air Force bases around the world. I am the daughter of veterans, and 64% of our board are veterans or veteran spouses. As an organization, we are guided by our lived experience, and we are dedicated to improving the lives of our nation's heroes. Next slide. Our model of care is distinctive and has proven to be very effective. We recruit dental professionals to provide pro bono comprehensive dental services in communities where veterans live. Our method of serving veterans is a collaborative and inclusive one. We include the veteran throughout their course of treatment. Veterans often feel like they don't have ownership of their lives, or feel like the programs that they have access to may offer help, but with limitations. There's often an underlying sense of mistrust that we must work through with each applicant we serve. By building trust, offering support, and answering their questions, they feel invested in the process, and the likelihood of positive outcomes is increased. Our veterans often spend a lifetime with urgent care at low-cost dental clinics, but never accomplish a healthy dental state. E4V's comprehensive care model not only resolves current dental issues, but sets them up for long-term oral and overall health, breaking the cycle of perpetual urgent care. The dental services that we provide are comprehensive. Our partners utilize bridges, root canals, crowns, and implants to eliminate pain, restore smiles, and replace shame and embarrassment with joy and self-confidence. In promoting comprehensive dental care, this by no means minimizes the importance of the urgent care needs model. We feel that this approach is very complementary to the larger existing urgent care delivery model. Coming alongside people in need so they don't have to go alone is at the heart of what we do. One veteran recently said, "I think the most important thing, regardless of the dental work, was the fact that I felt welcome back to my community by the people. I didn't think people cared anymore, and this program showed me that I still matter." Comprehensive dental care impacts the whole person, and with that in mind, our companion resource program was created. E4V recognizes that veterans may have other quality of life needs that impact the veteran's well-being. Our resource navigation and referral services program was designed to provide veterans with the resources from community partners in their area. This holistic approach to serving veterans and their families helps them to feel welcome back and appreciated. Next slide. Now that I've shared a bit about our organization, I would like to share some strategies that we have found to be very helpful in supporting veterans through their dental treatment. Traumatic events such as interpersonal violence, sexual assault, childhood abuse, and being exposed to combat are extremely common in our population. As healthcare providers, recognizing this is part of utilizing the trauma-informed care techniques. The tools and support for veterans during their course of treatment is important. According to the Substance Abuse and Mental Health Services Administration, there are many definitions of trauma-informed care and various models for incorporating it across organizations. But a trauma-informed approach incorporates 3 key elements: realizing the prevalence of trauma, recognizing how trauma affects all individuals involved, and responding by putting this knowledge into practice. According to the CDC, there are 6 guiding principles to this approach: safety, trustworthiness and transparency, peer support, collaboration and mutuality, empowerment and choice, cultural, historical, and gender issues. At first contact with our program, our staff members recognize that the individual's experience of trauma can greatly influence their receptivity and their willingness to engage with services. Speaking and listening with compassion and understanding is a very good first start. Most veterans are grateful and happy during their dental appointments. Next slide. For veterans who struggle with their treatment, the principles of working with dental fears in patients apply as well. Here are 4 recommendations to help dental providers support veterans who may be struggling with fear and anxiety during their appointments. First, veterans should be encouraged to discuss their mental health needs with their dentist and the team. Open communication can help veterans feel more comfortable during their dental visit and help dental professionals support them by creating the very best outcomes. Second, encourage veterans to use breathing techniques to help them relax their bodies and mind. Controlled breathing can help veterans focus on the present moment and reduce racing thoughts and stress. It's also important for veterans to practice mindfulness during dental care, as it helps them stay grounded and focused on the present. Third, help veterans self-talk to stay calm and relaxed during their appointments. Positive self-talk can help veterans build self-confidence, self-esteem, and also help them create a sense of safety and security. Finally, help create a calm and comforting space for veterans. This can include playing soothing music, using aromatherapy, or watching a favorite TV program. These activities can provide a sense of distraction and can help veterans stay grounded during their dental visit. Next slide. Working with veterans is a privilege and something that all of us here at E4V are grateful to be a part of. I would like to share a veteran's experience with you now that highlights the importance of this work and how critical it is to listen and support veterans during their dental wellness journey. Each day, we are honored to work with people like Christina, a U.S. Army veteran who served honorably during Desert Storm and Desert Shield. When Christina came to E4V, she was dealing with shame and embarrassment from a missing tooth that had been pulled 2 years ago. It was dramatically impacting her quality of life and her mental health. She shared with our team, "As a woman, I cannot begin to explain to you what this did to my self-confidence. I basically stopped smiling with my teeth. I would find myself only having my photo taken from one side and feeling embarrassed every time I was in public or when my grandchildren asked me why I had a missing tooth. We assigned Christina to the Bend Dental Group, who provided extensive comprehensive dental care, including an implant to replace her missing tooth. These wonderful volunteers were able to restore Christina's bright smile and bring back her confidence. In a letter to E4V, Christina shared what her experience was like. She said, "Everyone for Veterans and their network of dental specialists were an absolute godsend to me. The organization found a major discrepancy in dental care, had a vision, and implemented a service organization that had a major impact on my mental well-being and dental health. I will forever be indebted to them. Everyone for Veterans provides me and others, especially vets who are struggling with PTSD, the safety and social support network, which is essential to make it through those bad periods." When veterans isolate and withdraw from social interactions, the social support network provided by their dentists and the dental staff can truly be a life-changing bridge to wellness. Next slide. As we begin to wrap up our time together, I'd like to share a few practices that we have implemented to support our veterans' mental health. The first is expressing gratitude and is something that anyone can do. One of the most important things we can do for our veterans' well-being is to recognize their service and be intentional about showing gratitude. Honoring veterans throughout the year rather than just around Veterans Day is essential in demonstrating continuous appreciation to support of their service and sacrifice. Here are some important things for all of us to keep at the forefront of our minds. Veterans have made enduring commitments and sacrifices throughout their lives. Honoring them year-round ensures that we recognize and appreciate their efforts consistently, not just on one designated day. Veterans' service affects them throughout their lives, both physically and emotionally. By remembering them consistently, we acknowledge the lasting impact of their dedication and demonstrate a sustained commitment to their well-being. Continuous recognition raises awareness about the ongoing needs of veterans, such as healthcare, mental health support, housing, employment, and educational opportunities. This awareness can lead to increased public support and advocacy for these critical needs. A year-round commitment to honoring veterans fosters stronger community bonds. By regularly engaging with veterans, we build relationships and support networks that positively impact their lives and overall communities. This intentional year-round focus of honoring veterans is an essential expression of gratitude and support that reflects our ongoing commitment to those who have given so much for our nation. It promotes understanding, unity, and a stronger, more compassionate society. When veterans feel safe and supported by their community, they are more likely to ask for help when they need it. In closing, here are 5 ways that you can help veterans have a positive experience while receiving dental care. Educate yourself on common mental health issues and other challenges faced by veterans. We can never fully understand what our veterans went through. However, showing empathy and trying to understand as much as we can will be very much appreciated. Please explain everything to the veteran during their treatment, especially anything that involves sudden movement or noise. This will help set their minds at ease. With challenges of mental health, decision-making and other brain function may be hindered. Please explain treatment and scheduling and instructions simply and concisely for easy understanding. And when reclining a veteran for treatment, please let them know before doing so. Speak in a calm manner. This can help veterans ease their minds and help them feel more comfortable during treatment. Respect their time. It is important that we respect veterans' time and make sure their appointment runs on schedule. This will help boost their self-esteem and reduce stress that veterans may be feeling. And finally, show compassion. Showing a veteran compassion and understanding will go a long way to making them feel comfortable and supported during their course of treatment. Next slide. This work is deeply close to my heart and very personal to me. I am grateful for the opportunity to be a part of Everyone for Veterans. On behalf of the many veterans that we have the great privilege of working with, I would like to sincerely thank you. Thank you for your time today, and I look forward to partnering with you to serve those who have served. At this time, I would be happy to answer any questions that you may have.
Thank you very much, Jessica. That was a wonderful presentation. To start off, we have one question in the chat. Emily asked, point of clarification, please. On the needs slide, where the percentages showed 85% without VA benefits and 15% with VA benefits, specific to VHA dental only? And also, does your program cover the cost of dentures?
Yes, about 15% of all enrolled veterans in the VA healthcare system are receiving dental benefits. So it is a very limited number there, and that's part of that misconception. So it is around 85% or so do not receive dental benefits if they are eligible for those health benefits. And yes, dentures are included as well. So the care is comprehensive, and it's based on their specific dental needs. So sometimes dentures are the best option for that patient. Sometimes it's an implant or a bridge. It really is unique to that person and their treatment plan that they work out with the dentist that they're working with.
Thank you. Sarah Maddox asked, I work for a health professions university that focuses on caring for underserved populations. One of our dental schools offers a program that resembles your work. This program includes partnership with a federally qualified health center, so care is provided at a reduced rate. This outreach relies on donations and grant funding to support activities. Are you aware of funders who support this kind of work? Thank you for your answer and for this great presentation.
Yes, there actually has been a lot more support regarding grant funds for these types of things, as I think there's more community understanding for what our veterans are experiencing. And all of us today getting together, sharing this space and learning about these types of challenges are also helping to move that forward and provide more funding for these needs. So we currently partner with 4 dental schools around the country as well, where our care model is integrated in their services, and those programs are served with grant funds. So I know that there are other dental schools that have specific veteran care models as well, and we're very, very honored to be able to work with the dental schools that we do in providing this access to the veterans in their local communities. Does that answer that one?
I think so.
Okay.
But Sarah, I'll ask you to either come off mute or pop in the chat if you have any follow-up. Grace asked, how might the recommendations for dental care providers be shared? How can we encourage awareness and uptake?
So that's a great question. I would be happy to share the suggestions that we incorporate. If anyone would like to reach out to me directly, I'm happy to send those your way. I also have a link to a dental specific webinar that we presented, specifically helping dentists understand some of these issues. Many of these specific approaches are not considered when in dental school. Veterans are a unique population and their experience is very unique. And so I think talking on those points in a little more detail not only benefits the veteran recipient of the treatment, but also really benefits the dentist having a better understanding of how best to support the veteran during their treatment.
Thank you. And if you would send those resources to us, then we could post it with the slides and recording from today's webinar for folks to access.
Sure.
That'd be wonderful. Maren Lenhart asks, does Everyone for Veterans provide ongoing care with volunteer dentists, or similar to Dental Lifeline Network and a one-time comprehensive donated work to, quote, bring mouth up to a healthy state? Do veterans have a dental home with this program, and are there funds to support this, or are all donated?
So that's a fantastic question. All of our services are 100% comprehensive and no cost. So that does look different from mouth to mouth. What the person needs and the treatment plan is going to be completely individualized with the volunteer dentist that they are assigned to. So we work in kind of 2 ways. One way would be a veteran comes to us saying that they need care, and then we reach out to a dentist in their local community and recruit them to become a volunteer to serve that specific veteran. If a dentist reaches out to us and says they'd like to volunteer, we look for a veteran in their community to partner with them for this. So there's a little bit of a double approach there. Then once they are assigned, after going through our vetting process, we review their documents, make sure they're qualified, then we act as a liaison between that veteran and the dental office and kind of help fly alongside them throughout their course of treatment, making sure that it's successful. After their care is complete, we feel that they're set up, great for success in the future. Those main points are addressed. They're out of pain. They no longer have infection, we've restored aesthetics, and we've restored function. Those are our main program goals. So after all of that is complete, their treatment is done at that dental office. But more often than not, our veterans stay at that dental home because of the relationship that they have formed there. They will stay as a paying patient after that point. And we have dentists that have continued to provide care at no cost or reduced fees. But our main goal is to get them set up for success at that main appointment. And then ongoing, it is their choice whether or not to stay there as their dental home.
Thank you. I also want to flag that my colleague Liz Flannery, popped into the chat a link to information on the CDC's guidelines to trauma-informed care. So encourage folks to access that, and we'll also make that available with the resources from today's call. And Marion said, thank you. I appreciate this presentation and you're answering my questions. Other questions for Jessica? And feel free to take yourself off mute or to pop it in the chat. Jessica, I actually have a question. I was curious, and acknowledging that Liz put that link in there about trauma-informed care, but can you speak a little bit about how your oral health care providers are trained in trauma-informed care? Where did they get that training, and where can other dentists get that if they're interested?
So a lot of our dentists have gone through continuing education. In recent years, this has become a topic that has more and more understanding. I think for a lot of years, it was something that the general practice healthcare was focusing on and not realizing the connection that dental care provides. Even things that we realized during the course of the pandemic, where dentists are able to provide vaccines and things that we didn't even realize could have such a larger impact on their health, checking blood pressure, these things that they may not be accessing their general practice doctor, but they may be seeing a dentist, and they can help with some of those things too. So when we first meet a volunteer dentist in the program, we like to explain all of those things to them with access to resources that may be beneficial, explaining some of those things that I pointed out about the unique experience that veterans are providing. And then if there's any resources that we can help with, we don't claim to be experts in that field, but we're very grateful to partner with a lot of experts. So there's a lot of great work out there and resources that we're happy to forward along and connect to other organizations that are doing great specific trauma and informed care approaches. But really for us, a lot of that is through just understanding that our veteran population needs a slightly different approach than maybe the general population. And from there, those really beneficial conversations happen.
Great, thank you. Yes, Lucretia.
Oh, Jessica, you had a wonderful presentation, and I appreciate that. In the program, and also you are doing with everyone for veterans. You're speaking to my heart very much so, and I just love the presentation. The question I have for you, do you see more females versus males in the program that comes to everyone for veterans?
So we do tend to see more males in the program than females. And I think that's probably just indicative of the population of veterans that are out there. We also don't have any age requirements for our program. I know there's a lot of programs maybe specifically post 9/11. Our programs are open to veterans of any age, and the majority of our older veterans are males. We also provide access to dental care to spouses of qualified veterans as well. So we do see a lot of female spouses in the program.
Do you do rural areas as well?
Yes.
Okay.
Yeah, our program is open nationally. So anywhere where there's a need, we're going to work to find a provider in that area. I will say that there are a lot of geographic locations that are experiencing dental deserts, and it may be an entire county without a dental provider. So it could be, quite a drive. Our hope is to find those local community-based providers, but the reality is that doesn't always exist. when our veterans do live in very rural communities. We find that especially in the South, we have a bit of a longer wait list trying to find providers that are accessible to them based on their location.
Thank you. Thank you for your presentation. Excellent.
Thank you.
Thank you, Lucretia. Any other questions for Jessica?
Uh-oh, it's Maren again. I have another one. It's not bad though.
Go
Thank
ahead.
you, Jessica. This is fascinating. When you just said program open to all ages, I was like, woohoo, because Dental Lifeline's always 65 and up. Hopefully I was listening well and took a note that said your model of care addresses other quality of life concerns. And so that makes me jump into like community health worker space. Is that something, do you mean like you're calling those veterans the day before their appointment and kind of gently reminding them so that they'll show up and just helping through that bump? Or is that something like, hey, I also need help getting medicines or finding a mental health provider? Like, can you give me some examples of like what that scope would look like? Or maybe an example, because I'm sure it's different depending on the veteran.
Yeah, so that actually, formally our program was called a wingman program, and that came from the concept of the Air Force flying next to the lead aircraft and providing protective support. So our hope was to act like a wingman. Over the years, that program has evolved to be a resource and referral program. So we have learned over the years working with these veterans that there are so many quality of life things that are impacting them, that just basic quality of life, like access to food for their family, is such a bigger need than the dental care that they also need to be successful. So our program, the complementary program of resource and referral, is helping them to connect with those things in their local community. So when we do an intake interview with our veterans, we ask if there is anything else that we can help with. So veterans that specifically are experiencing traumatic brain injuries or PTSD issues or those, when you reintegrate into a community, there may be 30 different programs available to you in your community. That is so overwhelming with someone who is already feeling such stress and anxiety to navigate basic quality of life concerns and needs. So our program will kind of do research and dig into what is available to this veteran and what makes the most sense for their situation. So there may be 30 programs available, but we're able to help them identify 3. So that is much easier for the veteran then to work down that list and get nutrition support or a counselor in their area. Whatever they need, we specifically work to find that. It could be tires for their car. It could be holiday gifts for their children. It's really whatever their need is what we work to try and address there.
Thank you.
Great.
I love it. Thank
both.
you.
Thank you. And Jessica, I hope you'll stay on. We're going to transition to the case presentation part of our call. But please stick around, and we'd love to have your voice in this space as well. So this is the applied interactive learning portion of our call. And it is my pleasure now to introduce you to that and then to our presenter. So in this section, we have a presenter come in and present to us either a clinical or a programmatic challenge. And then we turn to you, our VOHAC call participants, to serve as a think tank and engage in some peer-to-peer learning and brainstorming to come up with some solutions. Next slide. So everyone's going to be assigned a breakout room after we hear from our presenter. A few of you, well, 1/3 of you are going to stay in the main room. The other 2/3 will be asked to join a breakout room. You'll have a facilitator in your room. And then when you're done, we're all going to come back to the main room for a brief report out, and then we'll share back the findings with you at a later date. So I'm going to introduce to you our presenter, who actually already had her voice heard during this call. Master Sergeant U.S. Army retired Lucretia Parker, retired after 28 years of honorable and distinguished service in September 2018. She currently serves as the President and Chief Executive Officer of Parker Executive Consulting, LLC, and Covered Heroes Foundation, a nonprofit organization working to bring dental care access to veterans. Her service continues through volunteering with Walter Reed Oral Health Team, Mission of Mercy Maryland, Maryland Women Veteran Memorial Commission, U.S. Department of Veterans Affairs Center for Women Veteran Advisory Committee, Project Give Back, Omega Psi Phi Feed the Homeless, and many more outreach services around the Maryland, D.C., and Virginia region. So Lucretia, And I'll ask to go to the next slide, please. To share with our group this scenario.
Yes, thank you so very much for having me. And I am part of the team. I think this is my, not the first time, but I'm glad to be here again. The scenario is a female veteran was born with a unilateral bony alveolar lip and palate with the resulting bony deformity and subsequent lack of front tooth. She had a bridge in place by the Navy in 2006. However, it fractured after she left the Navy, which resulted in a new worsening speech impediment, pain, and the inability to bite and chew. The veteran was able to secure dental appointments with the community support, but was unable to attend them due to traumatization and mental health impacts.
Next slide.
The discussion questions: how can providers and overall health system employ trauma-informed care to better serve our veterans? 2, how would an integrated care approach impact the way this patient and other patients with similar intersecting health concerns receive care? And 3, what other services and strategies can be offered to the veteran community to address the intersection of mental health and oral health?
Great, and thank you, Liz, for posting the scenario in the chat, and to Grace for posting the questions. So take a look at those. We're going to go into the breakout rooms now. Again, some of you will just stay here. And we're going to have about 10 minutes. So you'll get there at 12:44 Eastern time. We'll bring you back around 12:54 Eastern time, and then we'll do some reporting out.
And I know Stacy said this, but some of y'all are staying with us in the main room. So if you don't see an invite, just sit tight and we'll have our discussion here.
Great. And I want to ask, if you're here with us in this room, we encourage you to turn your camera on if you're in a place where you can do that. We'd love to see your faces, and find that there's just a huge difference in how people participate, that we've learned over the past almost 4 years now that we've been doing this Zoom thing all the time. So thank you. Thank you for being game and putting your cameras on if you can. And we're lucky to have Jessica here with us in this room. So we'll give you a minute or so, or a little less, to read the case again in the chat. And then when you're ready, we'll ask the first question: how can providers and overall health systems employ trauma-informed care to better serve our veterans, with this case in mind? And I'll also say, as they often do, the questions here in the chat build on one another, overlap a little bit. So if you want to tackle all of them at once, I think your answers don't need to necessarily be limited to just one of the questions. And we open it up to your thoughts.
Hi, my name is Tracy, and I'm in Arizona.
Hi, Tracy.
And our dental hygiene students host an annual clinic for veterans. But I think it's important for the veterans to have an interdisciplinary approach to care. So, for example, having social services at the dental clinic when we host our veterans care, having the physical therapy department at our site as well. Also having occupational therapy there, as well as having the social behavioral sciences department there. So the goal is to have an interdisciplinary approach when you're talking about veterans oral care, because there are other things that may impact their care, such as nutrition. We need to have our nutrition department there as well, because if we have all different disciplines working together to address the social determinants of health with regard to this particular veteran population, I think you'll have a better overall diagnosis with regard to how the veteran receives that care and also how that veteran continues the follow-up care with regard to mental health services or social services. They may not eat well because they have a lack of nutrition, or the lack of nutrition impacts the fact that they don't have any dental care. And so if they have very few teeth in their mouth, that affects their ability to eat. That can also be affected by if they don't have access to a food bank. Veterans here I'm in Flagstaff, Arizona, our veterans are often found at the food bank because they live on they're unhoused, they may live on the street, and they don't have access to some of the services that we normally assume, oh, you can just go to a grocery store and buy food. No, you cannot, because they don't have the funding. They've been discharged. They don't have that income anymore. And so they are disadvantaged. And so I think that to sum it all up, you need a interdisciplinary, multidisciplinary, transdisciplinary approach when you're talking about the veteran population. Thank you.
Thank you for that. And I have one follow-up question. So at your facility, when you have all these different disciplines represented and serving the veteran, who's responsible for coordinating it all?
So as a department chair, it would be my responsibility to coordinate all of that.
Okay.
And so the other different disciplines are housed in our same building. So we have a health professions building. And so I make sure that I have students from each different discipline at our clinic, and then also coordinating that with the department heads. So it starts with the administration, who's on board with a multidisciplinary approach to care, and then you also incorporate the dental aspect, the social services aspect. So it's up to department heads, department chairs, administration to be on board with a interdisciplinary approach to care. And so it relies on, the department heads to ensure that the students are informed, because oftentimes students don't understand that this is IPE, we call it interprofessional education. So they're learning to and from each other, but you have to ensure that you have the department heads there on board with the coordination aspect of it.
Thank you.
Thank you.
Others?
Uh-oh, I talk too much. So if nobody says it, it's going to be Maren from Iowa.
All right, Maren from Iowa. We're happy to have you.
I think there's lots of different ways. Just for answer one of how do we employ the overall trauma-informed care, I think what Jessica had said about open communication, I think I'm ahead of the ballgame there of you can't get the individual into the door. So that might look like just calling them, or this might, even something like this, face-to-face might be too much. So where do you build that trust? Who is their person? Is that somebody at the VA? And having a high level non-HIPAA conversation about what are ways to build that trust so that they feel cared for. And that might take a month, just like, or seeing, are they also having the mental health piece? That's not going to be just from that case. That's not going to be a quick fix in an hour either in the office. That'll be multiple. But right now, I think it's showing up and continuing to show up would be the very first thing. And then connecting, like, who is that health person or community health worker that they do trust, and without, in alignment with HIPAA, making sure that you have you have their permission to kind of talk about it is what my gut check would be with a trauma-informed lens.
Yeah, thank you.
So I can add how our organization would approach a case like this, because it's actually one that when I was reading the case study, I thought, I'm pretty sure we've worked with a veteran who's had a very, very similar experience to this. So the thing that jumps out to me is, one, it's a female veteran, and it says due to traumatization and mental health aspects. So we would have begun that conversation at the very first call when trying to set up that appointment, and asked, one of the key questions we asked in a situation like this would be, do you have any concerns with a male or female dentist? So right off the bat, setting that up for their comfort. We're not going to assume one or the other. And sometimes we find out a lot of information when we ask just a very simple question like that. And then in that explanation of what to expect. So at your first appointment, this is going to be just a routine check. We're not going to have any shots are happening. There's not going to be any drilling happening, letting them know what to expect at that very first appointment. And then from there, explaining to the dentist how to best explain the next steps with them when they have that appointment. Making sure that they know all the bits and pieces of what's coming really helps mitigate that fear that they're going to experience in that appointment. And the success of them actually going is going to be a lot higher because they don't feel like there's some big, scary unknown coming their way.
Thank you.
I have a follow-up question. Just so I was a dental assistant for 10 years before going into public health. What you just said, I love. I remember doing that with kids with sealants, trying to show them for adults. So just take the veteran component out. Quite often an adult would be, I don't want to do it. Just do it. Just do it. Just do it. And how do you respond to something like that where I will word salad too much thinking it's helpful, but have you not, like, how does, maybe that's before the call or letting them lead it, or I would assume the same thing would happen, and then you end up apologizing, which doesn't do anything and unravels that work.
I love when we can give agency to the veteran to drive. So when they have that ownership of how that goes. So asking them just a really simple question from the beginning, would you like me to explain the process that I'm doing? Like, has anyone ever explained how a bridge works? Do you want me to go through those steps for you? Or would you be more comfortable if I just stayed quiet and did this? Sometimes they want super over explanation because all of that talking helps them to process through the situation. And sometimes saying nothing would be so much more beneficial to their situation. So I love that you brought that up because I think that's really important because every person is going to be different regardless.
Thank you.
That's an amazing point. Thank you too for bringing that up. And can I be so bold as to ask when we come back, when everyone comes back, will you share that out, that point, Maren?
Wait, Jessica said it far more eloquently than me.
One of you can do it.
Well-
You can do it together.
Well, yeah, I can say that I can re-ask the question. How about that?
Okay, that's good. Welcome back, everyone. I think, Liz, is everyone back? I think so. Okay. So want to hear some highlights from your conversations, and I'm going to call on the folks in our room because we just had a really interesting discussion at the end. And Maren, why don't you kick it off?
All right, we were answering kind of the first question of how to employ trauma-informed care and one of the things that Jessica had mentioned in the presentation was explaining what is to come and those steps. And I had asked the question as a previous dental assistant, patients sometimes do want to know like detailed, or sometimes they're just like, stop, I don't want to know, just go do your thing. And how do you navigate those situations with a veteran? And then I'm going to let Jessica answer because it was very eloquent.
Thank you. And I think that it's important for all of us to realize that every single person is going to be different. And one veteran may want to know every single piece of the procedure start to finish. And so it would be really beneficial for the dental provider to say, would you like me to explain to you what we're going to do today throughout the process? Or would you prefer that I don't? Maybe that would bring up anxiety if we cover all of those things, and maybe being silent would be better for their situation. So it's really based on the individual and setting that up from the beginning so that that veteran has agency in that situation and feels empowered to be able to say, this would be helpful to me, or this would not be helpful to me.
Thank you. So not assuming that over explaining is better, trying to ease them through the process because they might just want to jump in. Great. Thank you both for that. What about someone from Grace's room?
John, you're up.
Oh, yeah. Okay. I'm sorry. I was looking for the name. Grace. I thought I was just group 2. So, yeah. So what we talked about was kind of interesting. It seems as though, this is a Navy veteran who had a disability, which came into the Navy with, sounds like, but it was restored. And then the bridge broke. And the we're assuming the intention was to rehabilitate this veteran by getting it repaired. However, it seemed as though from the wording of the vignette that there was a reluctance to even attend the appointment. They secured appointments, but they were reluctant to attend. And so one of our teammates brought up the idea early on of telehealth, which of course you're not going to do a telehealth bridge. Bridges, it's a procedure, it's a dental procedure that is a multi-appointment procedure. However, I think you can utilize telehealth services by maybe having the veteran communicate with the dentist via telehealth, either the phone or maybe even preferably like a Zoom meeting, so they can kind of get a sense for body language, to allow that veteran to be comfortable with the treating dentist, so that maybe they would begin to show up for those appointments. So, and a lot of our discussion focused around that.
Thank
The
you.
use of telehealth to kind of preload the situation and get that veteran to the level of comfort where they feel as though they're okay to even come to the appointment to begin treatment.
Thank you. And we have just 2 minutes left. Anyone from Matt's room want to share anything?
Hey, Stacy, I'll jump in and try to give a synopsis. I think it's a good mix between the two. Some of our conversation was around, what questions were we asking of the patient prior to even scheduling the appointment to know about trauma or the issues with care. So I think if you leverage that teledental visit, could you ask some additional questions to help, one, better prepare the patient, but then two, also better prepare your clinic and your staff for treating that patient. And then secondly, possibly the use of like a peer related service to have someone kind of go with the veteran to give them some support that they trust, to help them navigate that and maybe ease some of their anxiety or some of their reluctance to seek incomplete care.
Yeah, thanks for that. Yeah, a nice mix of reflections there. Thank you everyone for being so engaged and for sharing your insights.
I just want to say that the use of a veteran dentist may be helpful as well. That may be the first step to getting your foot in the door. We have 10% of our graduating class at the University of Pennsylvania. We're the latest partner with Everyone for Vets. 10% of our class actually goes on to one of the 3 branches of the military service. So they're out there and they're continuing to go out there. We have dentists veterans who are dentists. So that may be an important consideration to think about as well.
Thank you. Thank you. Rahel, will you take us back to the slides? And I want to remind everyone that you are eligible for 1 continuing education unit for attending today's session. Liz just popped the link in the chat, so please take a look at that. We'll also be posting a competency quiz to our website so that you could earn your program certificate once you meet the requirements for that as well. Do we have a next slide? This is our next slide. So this is our last VOHAC call of this year. Please stay tuned at the start of next year, and we'll be putting out some information about what you can expect from us in the future. But we thank everyone for joining us today, for joining us over the course of the year. A particular thanks to Jessica and to Lucretia for being our presenters today, for preparing so well, and to all of you for being such engaged participants. Wishing you all a good December, happy holidays, and we will see you next year. Thanks, everyone. Bye-bye.